From the News Channel 5 Network, this is OpenLine.
Hello, happy Monday to you all. I'm Jessica Ralston. Thank you so much for joining us here on Open Line tonight. In case you didn't know, November is Alzheimer's Awareness Month, and so a lot is being done to raise awareness and really talk to people about what's going on because, of course, this affects so many people. But there are other issues surrounding this. So to talk about it tonight, Elizabeth Mosick is joining us. Mosick from Barton House. You're the executive director.
I am.
And Dr. Stephen D'Amico, also from Barton House, who is the medical director.
Yes.
So thank you for being here. I guess we'll get started with talking about Barton House and what exactly services it provides, because there is a difference, you said, between obviously an assisted living facility for people who might suffer dementia or Alzheimer's compared to a nursing home. So let's kind of talk about that first.
Sure. So Barton House is Nashville's first and only dedicated memory care assisted living. So we've been around for almost 15 years and working with families and patients who have Alzheimer's or other dementia diagnoses is all that we do. And it's all we've ever done. So it's really very specific. We're very small, and we work with other larger regular assisted livings as folks need to transition into a memory care environment.
Okay. And I'm guessing, I'm sure you have a lot of older adults, but I would assume you treat a wide range of ages. Unfortunately, sometimes it does happen in younger people nowadays, right?
Yes, Alzheimer's can start at any age as early as 48 and go all the way. As far as, statistically, it's about 40% of people over the age of 85 will have some kind of memory loss. Not all of them need a memory care unit, but the majority, as they continue to progress, they will need some kind of care that's more than what can be provided at home.
Okay. And what, I'm sure we're going to get some phone calls tonight, and that reminds me, if you'd like to call in with any questions, make sure you give us a call here on Open Line 737+, and we'll do our best to take your questions and your comments and try to guide you in the right direction. So you said this is the only facility of its kind here in Nashville. Explain why there's a need for really a specific place.
Sure. Folks with memory care issues really need more attention, to be in a smaller environment, to have programming that's really designated just for them, and to be in a space where they can move about freely, but also to be in a safe and secure environment. So at Barton House, we are a secured facility so that they're safe.
Yeah, I know, because that's a huge concern with families, especially, we see it all the time. If a loved one has Alzheimer's and can easily go off wandering, in the middle of the day or the middle of the night, and then, they don't know where they are, and it can be terrifying. So it's great to have a secure environment. What are some things, is there any kind of therapy that you can still do with patients that have a full diagnosis, or things that help them?
I think it's important to differentiate between a nursing home, an assisted living, and a memory care assisted living. Whereas a nursing home, it's funded by the government, by Medicare or Medicaid. In an assisted living or a memory care unit, the family pays for the services that they would have. In a nursing home, if you needed to have, example, intravenous therapy for antibiotics, or if you needed a specific, like a feeding tube, that's something that would be a nursing home resident. If you need to have someone who just needs medication help and understanding that they need to have more direction, that would be an assisted living. The further advanced somebody gets into it, where they start having more problems with urinary incontinence, they can have problems not just forgetting to take their medicine, but not even knowing what medicines they're on. Those are the type of individuals that would need a memory care unit. And it's a fine line for some people and for families to make that decision for them.
I think, and it's a hard decision to make too, right? A lot of people, I think, really struggle with making that decision. I guess, and that would take us to the next question, is how do you know when is the right time? Maybe if you have a loved one living in your home, or they're still living in their own home, how do you know when is the time when you say, we need some help, we have to have someone intervene here?
Sure. It really varies from family to family, and we have people at home, and again, this is an issue for older adults. So if you have a married couple that have been married forever and they're both in their 80s, and you have one person who has Alzheimer's, as a caregiver it can be very exhausting. They're back to not sleeping very well, they're not eating as well, maybe the person does wander, so there's always that stress of if they're going to be safe. And oftentimes there's agitation that comes with the dementia process and folks with Alzheimer's, so that can be something that leads them to move into a memory care assisted living, is they just need that extra assistance that they can't provide in the home. And what we have at Barton House is we have more hands on deck. So we have nursing care, we have nurses on staff who are doing all the medication management, making sure that they have the right medications at the right times. We have caregivers that help them with their ADLs, which are their activities of daily living. So that's bathing and dressing and eating and going to the bathroom and all those little things that we all do throughout the day that folks with Alzheimer's just can't manage anymore for themselves.
Yeah. And I would think the level of care and compassion is so important to families, because I know a lot of times when people think about a nursing home per se, they think that your loved one's going to be put in there and, you know, abandoned, not loved and taken care of. And especially I would think someone with memory loss or dementia disorders, you'd really hope that if you put someone you love in the hands you know, of a facility like this, that they're really going to be taken care of and nurtured.
Of course. And I think that goes back to what Dr. D'Amico was saying about being in a larger nursing home environment, which definitely has its place in our healthcare environment, but also being in a small place like Barton House, where we are in a neighborhood with just 20 people, with full staffing care and just a really individualized program. A smaller place works better for folks with Alzheimer's. They just need the structure of daily programming. They need help with those things we talked about with activities of daily living, and just to be in an environment where people know them.
Absolutely. Okay. And speaking of that, we have information. I know, Doctor, you want to talk a little bit maybe about the warning signs,
yes,
things to look for.
There's some warning signs I think that people need to look for.
Okay. And we have the first 5 here. We're on the screen here. We can go over these, and then we'll go to the next one and talk about those too. So if you just want to go through each one step by step and kind of explain.
Well, memory loss that disrupts daily life. So if you have someone who has a memory problem that they can still operate within their own environment, that's still a problem, but it's not something that would disrupt it. If they have memory loss, for example, and they get in the car and they drive to Franklin thinking they're going to Franklin and end up in Franklin, Kentucky, that's a problem. Right. So there's an issue that we have to be addressed with that. In fact, I had a resident that did that for a patient. So I had to, yeah, we called and said he was in Franklin but couldn't figure out where my office was, but he was in Franklin, Kentucky. We have also, when there's challenges in planning and solving problems, there's it's called a mini mental exam, and there's different questions, 30 questions that you would ask, and those questions would be, for example, what's today's date? If you had 100 and you minus 7, how much would you have left? So there's some judgment issues that go and play with that. Difficulty completing familiar tasks at home, at work, or at leisure, meaning that they will not be able to complete a task with how they would approach for things. For example, puzzles. People that enjoyed puzzles all of a sudden can no longer do that. And one of the things that we've done at Barton is we've actually helped people with some therapies to try to get their judgment and get some of that eye-hand coordination back for them.
Okay. That was one of my, I mean, we can continue with the tips, but I wondered, is there anything you can do at this stage with people to stimulate them and to help them? Because I think, you know, a lot of times when you see maybe a husband or wife that has a spouse that is suffering dementia and they don't know what to do to help them, or you don't want to leave them sitting in a chair all day and not stimulating their brain and keeping them as active as they can be, right?
Correct, and I think that's an important issue that in any assisted living that someone would go to, is to make sure that there's activities that they can participate in. And it's not just activities of daily living. We have something called independent activities of daily living. That would be like for shopping, cooking, doing some things with the family. Those, when they start to decline, that's something that's important to be addressed with the caregivers that are there. And I think there's also one other issue that comes up a lot, is that, well, you had already said, when should we have mom or dad placed in a facility? It is individual, and it's a hard decision for folks to make. And I think they would first need to speak with their physician or their caregiver, their primary care person, and then at that point, see where they're at. There's 7 different stages that people can go through with dementia. Usually, most of our folks are in stage 5 out of 7, which means that they are not able to take care of themselves at all, and we're doing most of that for them.
Okay. All right. Well, we're going to get back to these warning signs we were talking about, and also make sure you give us a call if you have questions, and we'll do what we can to help you tonight. 737+. So we'll be back in just a minute.